Hey, good afternoon, everyone. I promised to keep this short, but I wanted to follow up after the meetings where I came out to the offices and met with everyone. It was a great time. Appreciate all your questions and insight, and wanted to give you a few updates since then, and looking forward to 2019. So we ended the year strong. We finished at 96.3% of our visits as a company, and we had same-store sales growth of 5.1%. And actually in December, we met budget for visits. So had a really good December. Seems to be a strong January, and looking forward to a great start to the year. So thanks to everybody's help and dialogue in the clinics, along with the managers in setting the 2019 budget. When everything was added in to the spreadsheet, we're looking at a new patient growth in our same stores of 5.72%, which would be just slightly above where we're at this year. Based on the initiatives that we saw and that were discussed, I feel that that's a very reasonable growth goal, and looking forward to that this upcoming year. Our visits came out at 10.41 visits per new patient. That's slightly higher than what it was this year. It was 10.36 that we ended the year. But again, within a range where we feel that that's a very accurate number, reflective of the care we provide, and is very attainable. The other thing that we had some conversation about in the clinics was more looking at, understanding our time codes, understanding our payer mix, understanding where we need to be as a company. So the regional managers will be meeting with their managers to go over the details that take into account payer mix, what percentage of our patients are CPT code payers versus Medicare billing rule payers. What is the typical trend of how we bill on our daily visits, and then looking at our visits per val within the clinic, and we use that calculation to come up with a target for each clinic that takes all that into account. So I think those are very, very good numbers that we're going to strive for this year, and so looking forward to it. I think it should be a great year. The other thing I want to touch base on is the getting better. We talked a little bit about the outcomes, but I also want to talk about a new program that is being utilized this year, and it's going to be the professional development opportunities. So thanks to a group that pretty much this last year, we had a group that met several times that looked at identifying aspects of what we do on a daily basis that's really important to be a well-rounded professional. And then thanks to Debbie Healy and Wendy Bloomhoff for really spending a lot of time looking at this program and vetting out the feasibility of using this going forward. So the professional development opportunities, why do we want to do this? So it's better defining what it means to be a professional. So it's identifying the key components, things that we've talked about, such as being a part of your community, leadership, self-learning and a continual learning, approach over the course of your entire career. And then it's mentoring and teaching others, okay? As well as understanding the business side of what we do, and understanding why the metrics are important, and striving for being well-rounded in the entire aspect of being a professional. The other thing is looking at it in terms of structure from a promotion of levels. What is a level 1 to level 2, level 2 to senior, guidelines that indicate this is what it looks like to become a senior in our organization. Okay. The other thing is looking at guidelines for individual and organizational improvement. So this is going to serve as a communication system, with all of our staff and our managers and the regional managers and the executive team, to look at where we are doing a good job in terms of our whole professional, development. Okay. So identifying ways that as an individual we can improve, but also as an organization. And then I would say, strongly for recruitment. More and more we get asked the question of what is it that you are looking for in a therapist in your organization? What defines being a professional in your organization? So going through and listing and being more specific with with the titles and aspects of this is going to better define what a professional looks like in Rock Valley Physical Therapy. So you can see below the purpose of that, just pretty much what I just talked about, but really excited for this to go forward. So what is this? So you will see this form coming out. It's going to be an Excel form that everybody's going to track individually. And there's basically 4 different areas within this, professional development opportunity. The first is the general activities and leadership. So that's being a part of your community. It's being part of leadership. It's being part of advancing our profession. We go back to what we used to call resume building, as promotion of our profession, promotion of Rock Valley, and promotion of yourself. So, those types of things will fall into the general activities and leadership. Active learning. What are you as a professional continuing to do to get better? Okay, the model may change from year 1 to 3 as compared to year 3 to 30, but we want to continue to encourage and strive for continued lifelong learning throughout the continuum of our professional lives. And then education and mentoring. How are we making everybody else better? I really emphasize of looking at having a great student intern program to a clinical program to when we have a new grad that comes on is ensuring that our mentoring is giving them every opportunity to become a great therapist in our organization. So those are kind of the 3 that have several different activities in there that you'll find when you meet with your managers. And then the 4th aspect of that is the clinical metrics. That's back to what I talked about this fall, was that that's the vital signs of our company, is of going through and looking at net promoter score, looking at completed cases, looking at arrival rate, productivity, and our time codes. And those metrics tell us as an organization something about our care model, but also tells us that are we doing well to continue with the mission that we've set forward. So we had a lot of good discussion as I came around to the clinics this fall. So I'd encourage continued discussion with that. And then the how behind all this stuff is, if it hasn't started, there's going to be introduction of this program from your clinical manager. Regional managers meeting with the clinical managers to further define, what falls into each sections, and then setting goals, setting targets, setting quarterly meetings that, this can become an opportunity to discuss on your continuum to in your professional development, what are things that are going well, what are areas for improvement, and then how are we going to get there. And the thing that I would say with this program is that we're looking at this as a 2019 pilot. Again, we've vetted it out with a group of people that have filled it out and give us feedback. But I think that there may be some further adjustments as we go through 2019. So this will not be used in a punitive means for 2019. The goal is to take this, get feedback, identify what looks really good in this, what areas we can improve, and then the goal of 2020 and having this a rollout as a component of our performance evaluation. And then the other thing I want to just touch on is that the role of the Director of Professional Development. Okay, we changed this title from Director of Educational Development to Professional Development. So as we look through 2019, the person that takes over the role of professional development is going to work with the executive team to develop modules and develop enhancing RockU and enhancing what we do, so that we are make sure that we are looking at all the mechanics of what it takes to be a professional in our organization. We certainly look for feedback. I mean, none of this stuff was directed from one single person. It's asking what people identify and what's important, and it's trying to take a lot of ideas and bring it down into, hey, what's the common theme that we hear and what makes it professional. And so we're really excited about this. Encourage you to ask a lot of questions, take an active role in utilization of this forum and the process, because it really is what we do. It is who we are, and it is what we do. And look forward to this as part of our professional development and continued improvement as an organization. So as always, don't hesitate to ask questions, certainly through the clinical managers, regional managers, or anytime you see any of us to ask questions. Certainly open to having a discussion. So more to come, but thanks for your time and have a great day.